All right, so administering nasal, eye, and ear medication. Starting off in the med room, I'm going to perform hand hygiene. I'm going to retrieve the patient's MAR and obtain the correct medications that the MAR calls for at this time. You're going to go over the 5 rights: right patient, right drug, right dose, right route, right time. And then you're going to discuss the nursing considerations for administering these medications. Once you have done so, you can take the medicine and go to the patient's room. You'd knock, ask if you can come in. You're going to perform hand hygiene, provide privacy, and then confirm the client's identity by checking their wristband. You're going to have them verbally state their first and last name and their date of birth, as well as scanning the wristband and also scanning any medication if needed. So starting with nasal medication, you're going to discuss the reasons for administering this medication. You perform hand hygiene and put on your procedure gloves. So there's either nasal spray or nasal drops. For a nasal spray, you are going to assist them to a high Fowler's position. You're going to offer them a tissue to blow their nose, and then remove the cap. You're going to have them exhale, and then on the inhale, you're going to block one nose, and when they're inhaling, administer the medication. And then do the same on the other side, block, and on the inhale, administer the medication. If they are nasal drops, you're going to have the client tilt their head back. You're going to not touch the dropper to the nostril. You're going to hold it about 1/3 of an inch above the nostril, and then apply the correct amount of drops to each one, and you're going to have them keep their head tilted back for the prescribed amount of time, usually just a couple minutes. And then that's administering nasal medication. You would take your procedure gloves off, perform hand hygiene, and document on the MAR the medication given and the medication given. For administering eye medication, there's either eye drops or like an eye ointment. So you would perform hand hygiene, put on new procedure gloves. You would again before administering any of the medications, you would confirm with the client about their allergies, and then you would discuss the nursing considerations, or you would discuss the reason for administering this medication. If they're able to do it, you would let them do it, but if not, you'd do it for them. For eye drops, you would unscrew it. You never want to touch the tip of the dropper to anything. You're going to take it with your dominant hand and rest your dominant hand on the forehead. Ask them to look up. You're going to pull down and administer the correct amount of drops to the conjunctival sac. And then if it has a systemic effect, you're going to hold the inner aspect of the eyes along the nose to block the lacrimal ducts so the medication doesn't enter the system for 1 to 2 minutes. And then you can have them use the tissue to wipe their cheeks. If it is a eye gel, you're going to again do the same thing, pull it down without touching the tip. You're going to apply a 1-inch strip working from the inner aspect to the outer aspect, and then have them gently close their eyes for and keep them closed for 2 to 3 minutes, reminding them that their vision is going to be blurry for a little bit after. And then you would remove your gloves and document on the MAR the medication that was given. And then again, that would be in high Fowler's position. For administering ear medication, you're going to do hand hygiene and put on new gloves. You're going to assist the client to a side laying position so that the ear that the medication is going in is facing up. You can clean the external ear with a cotton tipped applicator, but not the inner ear. Again, you're going to remove the cap. You don't want to touch the tip of the applicator to anything. You're going to pull the top of the ear up and back and administer the correct amount of drops. You're going to have them sit there for 5 to 10 minutes or the prescribed amount of time. If it's a prescribed amount of liquid, you're going to fill the dropper with the correct amount of liquid and administer it, again pulling the ear up and back. And then you would cover loosely with a cotton ball and leave that there for 10 to 15 minutes. And then you would remove your gloves and document on the MAR the medications given, and the locations they were given.